Brazil's COVID crisis is a warning to the whole world. COVID-19 has already left a trail of death and despair in Brazil, one of the worst in the world. Now, a year into the pandemic, the country is setting another wrenching record. No other nation that experienced such a major outbreak is still grappling with record-setting death tolls and a healthcare system on the brink of collapse. Many other hard-hit nations are, instead, taking tentative steps toward a semblance of normalcy. But Brazil is battling a more contagious variant that has trampled one major city and is spreading to others, even as Brazilians toss away precautionary measures that could keep them safe. On Tuesday, Brazil recorded more than 1,700 COVID-19 deaths, the highest single-day toll of the pandemic. The acceleration of the epidemic in various states is leading to the collapse of their public and private hospital systems, which may soon become the case in every region of Brazil. Sadly, the anemic rollout of vaccines and the slow pace at which they're becoming available still does not suggest that this scenario will be reversed in the short term. Preliminary studies suggest that the variant that swept through the city of Manaus is not only more contagious, but it also appears able to infect some people who have already recovered from other versions of the virus. And the variant has slipped Brazil's borders, showing up in 24 other countries and in small numbers in the United States. Although trials of a number of vaccines indicate they can protect against severe illness even when they do not prevent infection with the variant, most of the world has not been inoculated. That means even people who had recovered and thought they were safe for now might still be at risk, and that world leaders might, once again, be lifting restrictions too soon. That danger of new variants has not been lost on scientists around the world. Rochelle Walensky, director of the U.S. Centers for Disease Control and Prevention, pleaded with Americans this week not to let their guards down. Brazilians hoped they had seen the worst of the outbreak last year. Manaus, capital of the northern state of Amazonas, was hit so hard in April and May that scientists wondered if the city might have reached herd immunity. By January, scientists had discovered that a new variant, which became known as P.1, had become dominant in the state. Within weeks, its danger became clear as hospitals in the city ran out of oxygen amid a crush of patients, leading scores to suffocate to death. Scientists have scrambled to learn more about the variant and to track its spread across the country. But limited resources for testing have kept them behind the curve as they try to determine what role it is playing. The variant spread quickly. By the end of January, a study by government researchers found it was present in 91% of samples sequenced in the state of Amazonas. By the end of February, health officials had reported cases of the P.1 variant in 21 of 26 Brazilian states, but without more testing it is hard to gauge its prevalence. Just over 5.8 million Brazilians, roughly 2.6% of the population, had received at least one dose of a COVID-19 vaccine as of Tuesday. Only about 1.5 million had received both doses. The country is currently using the Chinese-made corona vaccine, which laboratory tests suggest is less effective against P.1 than against other variants, and the one made by British-Swedish pharmaceutical company AstraZeneca. Wearing a mask is highly effective and can make your daily life safer for those around you, but it's not a permission slip to return to normal. It's important to stay home when you can and continue practicing other coronavirus prevention measures like social distancing to help reduce the spread.